All right. Please, can you all hear me?
Yes, sir.
All right. So let's get started. I recall that last week when we met, we were discussing biomolecules, or what we call the various forms of biomolecules. And so we are done with the intro. I think I started with some of them. Before I add on to what I have on table today, I want one of you to sum up what you picked up from last week's lecture, and then we'll move on. Yes. Hello, class. Yes. So what do you remember from last week's lecture?
Hello, sir.
Hello, please go ahead.
All right, so I remember last week we were talking about gases, where we talk about it interplay with our systems in one way or the other. And we said in humans we have oxygen and carbon dioxide in Earth, whereby we also talk about some groups of organisms called methanogens. They also survive on methylene gases. And we said oxygen is the most abundant biomolecule necessary for human life, and it's within our cells, for all cells within our body. And you also made mention of anaerobic respiration that makes use without oxygen, and then aerobic respiration involving oxygens. So that's what I heard from the initial discussion.
All right, thank you. Maybe a point of correction. I didn't say oxygen is the most abundant. It's actually water, which is the most abundant. Okay, but I said oxygen is the most important.
Sorry, it's most important. Sorry.
So it's the most essential biomolecule for human survival because we are aerobes. We are more or less like obligate aerobes. We can't do without oxygen. And so it's very fundamental for our survival. And again, much of our body's energy needs are generated from aerobic respiration. And therefore, oxygen is very essential for generating the needed energy for various active and passive physiological processes, and even for compensatory physiological processes. Are you okay? So very, all right. Thank you, Honorable. Yes, anybody else?
Okay, sir. So I also heard
Yeah.
about how enzymes like catalysts helped us to break excess hydrogen peroxide in the blood into water
Okay.
and then carbon dioxide. Thank you, sir.
Will you read the question?
All right. Thank you, Honorable. So catalysts act as a physiological antioxidant which occur in our blood and helps us to be able to deal with what? The reactive oxygen species. Okay. Find a book. Yes, any other person? Hello, ladies. It looks like it's only my gentleman. It appears it's only my gentleman who are say any lady who can also share.
Hello, sir. Hello. Hello, sir.
Yeah, please go ahead. I'm listening, Helena.
Okay, last week you made emphasis on the fact that even though oxygen is needed in the body, when a client comes in respiratory distress and we want to set up, the oxygen have to be regulated because too much in the body, if the hemoglobin couldn't bind with it, it can cause embolism. Thank you.
Yes, you're welcome. That's beautiful. That's beautiful. So you constantly must monitor. Are you okay? All right, that's great. Yes, maybe one last lady. I got two gentlemen. So may I get another lady to match up so we balance? Yes, anybody? Hello, people.
Hello.
Yeah.
We also talked about carbon dioxide, whereby you said a residual part is being retained for a purpose for homeostatic physiological adaptation that is being retained in the blood and then respiratory spaces. We also talked about the functions of carbon dioxide, where you made mention of physiological carbon dioxide is used in carboxylating reactions, that is chemical reactions involving carbon dioxide in amino acid formation in the liver, and also physiological carbon dioxide is used in maintaining blood pH by acting as a buffer, that is carbonate buffer system, where it dissolves in water and blood to form carbonic acid and is later form hydrogen anions and carbonates. Yeah.
All right, that's beautiful. So essentially, the physiological carbon dioxide, like you pointed out, it's not carbonation, carboxylation reaction. Your book. Fisher. Hey, come and get your. All right. So thank you all. So it looks like we are left with what? The minerals. Did I tell you to go read about the minerals?
Hello, sir.
Yes.
Hello, sir.
Yeah, honorable.
Please, with the carbon dioxide, sorry, I'm saying that with the carbon dioxide, you said he has three main functions. You gave us two. as it's been used in the carbonylation reaction and also helps in the maintaining of the blood pH. The third one didn't give us, and the time just elapsed, so we aren't done with it. I don't know whether.
Okay, but yes, you could have also read about it to find out, Honorable. Anyway, so let me say that physiological carbon dioxide, maybe as a third function, what's the right word to use? They stimulate, okay, the instinct of breathing. Are you okay? When you have too much carbon dioxide trapped inside your system, they induce what you call inhalation. Are you okay? They enable you to be able to breathe. Are you okay? That's why when you have so much carbon dioxide trapped in your blood, you see that you hyperventilate, you breathe quickly. Are you okay? So the level of carbon dioxide within our blood, in a way, homeostatically helps to control our breathing rate. It helps to control our breathing rate. It calls for, it's not only the physiological carbon dioxide that does it, but it does it with other intervening factors. Are you okay? But it's very, very important in that complex in helping to maintain our respiratory rate, okay, or our breathing rate, if I may put it in that sense. Are you okay? So if your oxygen saturation or carbon dioxide saturation is normal, you tend to have a normal breathing rate. But if it's excessive, if you have too much carbon dioxide trapped in your blood, you see that you breathe very quickly, so that that's what we call hyperventilation, so that you can get rid of a lot of the excess carbon dioxide trapped in. And then if it's also very low, you would realize that your breathing rate is also what reduced. Okay, so that you can help to keep some in to balance out the amount that's needed. Are you okay? Homeostatically. So if you ask for the third function, that's basically what I would say. That physiological carbon dioxide helps to control our breathing rate. Are you okay? Hello, gentlemen. Please, are you okay?
Yes, sir.
All right. So I was making a correction here before I think I ad-libbed. I think one of the respondents was saying that carbon dioxide, physiological carbon dioxide, are used in carbonation reaction. It's actually not carbonation. We call it carboxylation. So carboxylation reaction. And one example is in the case of the synthesis of amino acids. So usually for amino acid synthesis, the primary amino compound will have to be carboxylated, IUK. And this helps IUK in the introduction of the acid group, IUK, which consummates the formation of what we call the amino acids, IUK. Yes, in many cases, you would only have what you call a keto acid. So the carboxylated group would already be there. So all you need will be to add the amino group. So we call it transamination reaction. But sometimes you may also have to do what we call transcarboxylation reactions, where you now incorporate the carboxyl group. And that's where carbon dioxide comes in. Are you okay? So that's basically about that. Please, are you okay? All right, so let's look at the minerals today, and then we'll switch quickly over to the organic biomolecules, and then we start with either carbohydrates or proteins. I just hope that I'll be able to maximize the time we have and do something virtuous. But before I go ahead, let me find out if anybody has a question for me regards to what we did last week before the time elapsed. Does anybody have a question? Did you read something that you don't really understand, or did I make a statement that you don't really understand? Hey, class, you're too quiet. Yes, anybody?
Hello, sir.
Hello, Mr. Bonsu.
Hello, sir.
Yeah, go ahead.
The last time you mentioned about the free radicals.
Yes.
You mentioned of the free radicals, and you said we have the reactive oxygen species.
Yes.
Yeah. So, like, I wanted to know the free oxygen radical. Is it different from it, or is a different name?
Okay. I think I explained this. When we say free radicals, it's a larger group. Okay, it's a larger group. And when we say free oxygen radical, then we are referring to those reactive oxygen species I mentioned. So the ROS is a subset of what we call free radicals. Okay, you can have the free nitrogen radicals, free sulfur radicals, and etc. They come in different forms. Okay, but the reactive oxygen species is also an example of what you call free radicals. So they are not the same. Probably what you may also say that free oxygen radicals, then that will be understandable. But if you just say free radicals, that's a larger group. Are you okay?
Yes, please. Thank you.
You're welcome. Yes, any other? Okay, so if there's no question, then let's move. Mr. Roxon, ammonia really is not part of physiological buffer, but we can talk about phosphates. Okay, so we have the phosphate buffer. And then you have the phosphate buffer, the bicarbonate buffer, and then you also have the protein buffer. Okay. There's nothing like ammonia buffer in the blood. Ammonia actually is very toxic. Very, very toxic. Okay, that's why when transamination reactions go wrong in the liver, it can result in encephalopathy. So ammonia is very, very toxic. And it's not really useful as a buffer in the blood physiologically. Okay. All right, so let's start off with the minerals and then we'll move on. At least now that the road is clear. So We have number 3, minerals. I told you there are 2 types of the minerals. We have what we call the metals and what? The non-metals. So the metals include what? Number 1, sodium, potassium, calcium, iron, magnesium, manganese, selenium, molybdenum, copper, and etc. Okay. So these are what we refer to as a mineral. Physiologically, they are required in very small quantities. They are required in very small quantities. But they are very essential in our body. The non-metals include the chloride, the phosphorus, the fluoride, the sulfur, and etc. As I said about the metals, these ones are also required in what? Very trace amounts. So in some textbooks, they call them the trace elements. Why? Because they are required in very small or minute amounts. But their function is very, very pronounced, and in many cases, it depends on them. Physiologically, they function as 1, as components of enzyme structure to facilitate biochemical reactions. They function as what? Components of enzyme structure to facilitate biochemical reactions. Number 2, so here, common examples include zinc, which serve as a cofactor. So we call them cofactors. Zinc serve as a cofactor for what? The enzyme carbonic anhydrase. carbonic anhydrase. Iron serve as a cofactor for catalyst. Magnesium serve as a cofactor for the enzyme hexokinase. Manganese serve as a cofactor for what? Superoxide dismutase. So these are all enzymes, and these are metals. And there's a classical example of how metals help in a metabolic reaction by contributing to the structure, the stability, and the functional competence of various enzymes, as I have enumerated here. Okay, there are more, but these are at least a good starter. Number 2, the minerals provide or complement stability to the structure of other biomolecules. They provide stability to the structure of other biomolecules. Example, iron help to stabilize hemoglobin. Calcium occur in calmodulin. Copper occur in ceruloplasmin. Fluoride occur in what? In the enamel of teeth. The enamel contains a compound called hydroxyapatite. Hydroxyapatite. This compound contains some fluoride. That's why we say fluoride is important for strong teeth. Okay. So all of these goes to buttress the point that these minerals are not just useless, they are very useful in our body. Apart from the fact that they complement enzymatic reactions, they are also important components of other biomolecules which are important for our survival. So we all need hemoglobin, but hemoglobin is never stable without iron. Then you have calcium in calmodulin, copper in ceruloplasmin. These are all plasma proteins. Then fluoride in the enamel of teeth. All right. Please, can I go on?
Sir, please,
So
calcium occurs in
calmodulin. Number
okay.
3, physiologically, the ions of these minerals help in maintaining osmotic balance. In maintaining osmotic balance. That's why when somebody have hypernatremia, they tend to develop edema. If they have hyponatremia, it comes with a lot of consequences. Okay, so normonatremia is what is ideal. Are you okay? And etc. So the ionic forms of these minerals, whether metals or non-metals, are very important in maintaining the osmotic balance. The fluids in our body are very, very saturated with a lot of solutes. Some of these solutes are complex, some are very simple, some are ionized, and some are neutral. For example, you have a lot of sodium, calcium, chloride ions in circulation, most especially in extracellular fluids or intravascular fluids. Are you okay? So the levels in either of them, whether intravascular, extracellular, or interstitial, helps to provide some kind of balance. Are you okay? And the balance is necessary because it helps us to also be able to balance out water within our body. Are you okay? And any imbalance can create a pathological outcome. The example is what I gave you. When you have too much of sodium in your blood, it raises the blood volume because it helps or it causes the reduction in loss of water. Are you okay? So the blood volume rate rises, and then that can influence the heart rate, okay, and the heart pressure, okay, because it puts a lot, when the blood volume rate rises, it puts a lot of constraint on the heart, okay, so it increases the risk of hypertension and other complications, okay, and etc. Sometimes you have excessive amount of these ions accumulating in interstitial fluid, which draws a lot of water into those interstitial spaces, and that results in what? In what we call edema. Again, when you have too much of them also in the blood, the kidney has to overwork to be able to remove them and ensure balance. And in overworking of the kidney, the risk of developing a kidney disease or complication is also very high. Are you okay? So they are just not passengers within our body. That's essentially what I'm trying to let you know. They are very important in one way or the other. In fact, hyperkalemia, that is raised potassium levels, are you okay? It is always, in many cases, associated with what? Or can cause, it's already been established. Okay, hyperkalemia has been established as a cause of hypertension and cardiac arrest. So in many cases, when patients come to the hospital comatose, you realize that there are three major tests that are done to ascertain what could be done to help them. Number one, you check for blood glucose. Are you okay? If it's hyperglycemia or hypoglycemia, because extremes of normal glycemia can result in a critical condition or can cause coma in one way or the other. Then you also check for oxygen saturation or blood gas. Are you okay? Hypoxemia, are you okay? Or excessive carbon dioxide saturation in the blood, either by metabolic acidosis or respiratory alkalosis, are you okay? Can all result in what? In comatic condition. And so when you realize that there is reduced oxygen, then you can apply the intervention by administering some oxygen. If the patient is helpless, you put them under ventilator to help, as it were, oxygenate the blood, ideally, to ensure that they recover, if the intervention can be applied in time. The third one is to check for blood ions. Are you okay? So you go for the electrolytes, the potassium, the sodium, because these are very critical. When there is excessively elevated potassium in the blood, probably it can result in what? Cardiac arrest. So when you realize that, you put them on dialysis so that you can remove a lot of the potassium ions to ensure that the patient recover. Are you okay? If it's excessive sodium, the same thing, you put them on what? Dialysis. Are you okay? But if it's reduced potassium or excessively reduced sodium, then probably you can administer Ringer's reagents. Sorry, you set up IV and then you administer Ringer's, are you okay, to help ensure balance in the body iron. So what I'm telling you here, are you okay, transcend the lecture room. This is real life, are you okay? And any small imbalance in the distribution of these ions can cause very, very dire outcomes, are you okay, and can end a patient up in the emergency or in critical care unit. Please, are you following me?
Please, yes.
Okay. All right. The third or the fourth point, maybe let me add one small one, and then probably I would leave the rest for you to read about. is that these ones also help the minerals. Are you okay? They also help in nerve impulse coordination. They help in nerve impulse what? Coordination. Polarization of nerves involve what? Anytime you take the nerve, are you okay? Especially in the axons of the nerve, you need to have ions crossing the membranes. Are you okay? The neural membranes. And this is what creates what we call polarization. In a way, the polarization is more or less like to activate them and get them to work. Are you okay? So nerve impulse coordination or polarization require the movement of ions across the membranes, whether at the axons or at the myelin sheath or anywhere of the nerve. Are you okay? Most especially the sodium and the chloride ions. These are very crucial for nerve impulse what? Coordination and polarization of the nerve. Are you okay? Very, very important. Are you okay? All right, so let me ask if anybody has a question for me. If there isn't any, you can switch over. All right, so I'm done with the minerals so far. One last thing, and then we switch over. The minerals physiologically, the minerals occur whether as metals or non-metals. Okay, they occur as ions in body fluids. And my question is why? Why do they occur as ions in body fluids? Yes. Hello, class. Can you all hear me? Hello?
Hello, sir. Please, we can hear you.
So let's talk. All right. Yes. So talk to me. Why do they occur as ions in body fluids, but not as neutral? Why are they not neutral species, but they occur as ions?
Hello, sir.
Positively charged or negatively charged? Yes.
Please, they occur as ions because these ions are electrically charged and they are highly water soluble, allowing them to dissolve in the body fluids.
Oh, that's very beautiful. Who said this? May I know your name?
Please, I'm Sandra Boatema.
Yes, Sandra, well done. Nyamisha ati Yesu ba be kobi wa.
Amen.
Omo aka ndem nhyɛ da ni ba yɛ bɔ mpae. All right. Yes, any other? But that is not all. That is not all. So the ionic nature is to improve its solubility in the body fluids, most especially because much of the body fluids contain water, if you remember last week's lecture. And so the ions are more or less like it improves the hydrophilic character of the minerals. Okay, yes. Any other? There's another one, very, very special one. That one, if you can say, yes, you join the seraphims.
Hello, sir.
Hi, dear.
Sir, please could it be that they come in iron form so that they will be able to cross the membrane?
Hey, madam. That's a very good attempt. Maybe this one too, you go to heaven, but not so close. But that's a very good effort. Lydia, thank you very much. Thank you. Yes, let me go to Rashida.
Okay.
Hello. Yes.
Hello, sir.
Yeah, Ajia.
Can I say they occur as ions in body so that they can dissolve in water, because they can dissolve in water, conduct electricity, and also carry out vital functions.
Yeah, that's interesting. But I think that's what Sandra said earlier. Probably
okay.
you have added of it to it. So
Okay.
Rashida, you too. We'll check you up in heaven. God bless you.
All right.
Yeah. Yes, any other? This was the second one. Why are the minerals usually ionized in body fluids? And this is, I mean, the reality. In your blood, calcium is not elemental calcium, it's Ca plus. Potassium is K plus. Sodium is Na plus, and etc.
Hello, sir.
Yes, honorable.
Can you also say that they also help in achieving a buffering system, thereby preventing either body becoming too acidic or alkalinic?
Not really. In fact, the danger is that many of them, if they are left as elemental, maybe I'll talk about that. But let me not rush it. But that's really, it's a very good attempt, but not, I like the line of thinking. Okay, but actually they don't work as buffers. Okay, I know in chemistry there's a concept like that, what we call the Lewis acid and the Lewis basis, where sometimes some of these heavy metals like molybdenum, selenium, are you okay? and copper in their charge form are able to accept electrons and therefore as Lewis acids and all that, but not necessarily so. Okay. In this, yes, Emmanuel, your hand is up. Hello. Hello, class.
Hello, sir.
Yes, honorable. Yes, give me the reason and let's go. This is very basic. Are you okay? I told you on the first day what we meant, that my lecture will not be that I'm going to share everything with you. I expect that you also share something with me. And this is my question.
So how about 7 as cofactors?
We've already established that. So it can be. Hey, nurses, please, let's do this quickly.
Sir, please, your question again.
My question is, my dear sister, I'm asking that why is it that physiologically in most of our body fluids, where we have a lot of these ions, they tend to appear as ions and not as neutral elements?
Okay, sir, maybe it's because the body can only use them when they are charged.
Hey, madam.
Hello, sir.
Wizzy, do you know that Jesus is watching you? Yes, honorable.
Sir, the ionic form of these metals is necessary for biological activities, transport, and then homeostasis.
We've already established that, but there is more to that. Okay, so maybe if I have to help, it's very simple. They are, I don't know, can we do some small chemistry here? And then maybe just to explain the point to you. Who remembers the atomic number for sodium? Yes. Does anybody remember the chemical symbol for sodium?
Na.
Na, okay. Sodium has how many? What's the atomic number?
11.
It's 11.
11.
Okay. So what does it mean? It has 11 what? Electrons, isn't it? So we're going to have, we have our nucleus, and then we have 2 electrons here. Then we also have what? Another 8 electrons. Are you okay? And then we have what? Another what? 1 electron. Can you see that? So it's like 2, 8, and what? 1. That's the electron distribution. Now, what's the charge on sodium ion?
It's positively charged.
Okay, so Na plus. Now, what will be the atomic number? It is still 11. Okay, so we're going to have a nucleus. Now, how many electrons are there in sodium ion, Na plus? How many electrons?
10.
It will be how many?
10.
10. Very beautiful. So we already have 2 here. We are left with what? 8. So the electronic configuration will be 2 and what? 8, because 1 electron is lost. And that is what has resulted in the positive charge. Are you okay? All right. Now let's compare the two. Which of the two is more stable?
The one that has lost electrons.
Very good. So it's very simple here. When the minerals become charged, they attain stability. Are you okay? They become very stable. They become what? Very stable. And this is the right way in which we need them. We need them to be very stable, because if they are unstable, what could be the problem? Can somebody tell us? If they are unstable, they will react with our body tissues where they occur. So sodium, instead of going through our neural membrane, will be reacting with our nerves. Chlorine will be reacting with our nerves. And you can imagine, if they are reacting with the nerves, they will destroy them and will rather be paralyzed rather than, or develop neurodegeneration rather than conducting impulses. Are you okay? Calcium ion is very important in muscular activity. Example, the cardiac muscles ability to what? Generate pressure. It requires some amount of calcium activity to be able to do this. Just imagine if calcium is very unstable and reacting with the cardiac muscle, the heart will fail. So they have to be converted to the ionic form where they are what? Most stable. And because they are stable, they become harmless. They become harmless in the tissue where they occur so that they can make the necessary impact. Are you with me?
Hello, sir.
Yes, yeah.
Sir, please, the part you were explaining the chemistry, the sodium part, please, I didn't get. I didn't get
You,
it. Can you explain again?
I didn't mean this to be chemistry. It's just a revision we're doing.
Oh, okay.
Or you still want us to do the chemistry?
So if it's not necessary, fine. If it's necessary, then please do it.
So what do you say?
So please explain again.
Okay, fine. So we said that if you take sodium as an element, it has 11 what? Electrons, because the atomic number is what? 11. Are you okay? Now, how are the electrons distributed? We have the nucleus and then the first shell, which takes 2. The second shell takes how many electrons? Hello, our lady. It takes 8. Okay? And then there's a third shell. The third shell will take the 1 because the 2 plus 8 is 10. And then we have one more left, which is what? The one that goes to the last shell. So the electronic configuration will be 2, 8, and what? 1. So the last shell is neither half filled nor fully filled. So it's very unstable. But when sodium becomes an ion, by losing an electron, it now has, instead of 11 electrons, it will now have what? 10. And the 10 electrons are well distributed across the 2 shells. Are you okay? So all the 2 shells are fully filled. Are you okay? And the sodium here is most stable. Hello, our lady. Do you get it now?
Yes, sir. Thank you.
You're welcome. All right. So this is basically why the minerals exist as ions within the various body compartments where they occur. So in hemoglobin, iron is what? Iron 2. And then when it picks up oxygen, it moves from ion 2 and become what? Ion 3, because it is oxidized. Then when you release the oxygen to the tissue, it revert back from ion 3 to what? Ion 2. So ion 2, then it becomes what? Ion 3. And then when it delivers the oxygen, it goes back to ion 2. Then it picks up the oxygen again, and it becomes ion 3. And then that's the way. So it alternates in this form. Sodium in our blood is Na plus. Potassium is K plus, whether in the cell or in interstitial fluid or probably in the blood. Are you okay? Hello, everyone. All right, so this is basically a summary of what the minerals do. So we are through with what I call inorganic what? Biomolecules. I want us to switch over to the next one. But before that, let me hold on. If anybody has a question, please raise your hand and let's allow you to ask your question. Yes, anybody, please. Grace,
Sir,
please let me know, is it Deborah or Deboah?
Deborah.
Deborah, okay, okay. Yes, Grace, let's hear you.
Sir, please, the explanation you gave, I'm still not getting it. About
Which one?
why the mineral usually ionize in body fluid.
Take it, it's straightforward. They ionize so that they can become stable chemically.
Okay.
And once they are stable, they are not troublesome. You see, if you are in the house and your children are well fed, they won't cause trouble. I'm sure you understand.
Yes, please. Well understood now.
But when they are hungry, then they'll give you issues. So
Yes.
when the minerals are very stable, then they don't become too reactive. So instead of reacting with it, various species, they can just help with other physiological processes and not react with them to cause any damage. Are you okay?
Okay. All right.
All
Thank
right.
you very
You're welcome, Grace. Yes, anybody else? Hello, class. Please, I don't want anybody to be bringing us back again. That's why I'm actually patiently moving. Okay. So you can raise your hand if you are not clear with anything, because once I make the switch, I wouldn't be coming back. Yes, Mark.
Very good morning.
Hello, Honorable.
So, sir, I was asking the stability of the metals. Is it as a result of the ionic bonding, or I think in
It's
GHS
just,
we learn
let's not go into ionic bonding and all that. The point is that when they lose electrons or gain it, they are able to fill their shells, the outer shell. And once the outer shell or orbitals are filled, then they are stable. That is. Mark, are you okay?
Yes, sir.
If I start talking about the bonds, I don't know. Probably this class will be a different thing altogether. So just take it like that.
Thank you, sir.
You're welcome. Yes, maybe one last one. Hello. All right, so we're done with this. So let's move on to the organic biomolecules. The organic biomolecules The organic biomolecules consist or are classified into four major groups. We are what we call the carbohydrates, the proteins, the lipids, and the nucleic acids. Hello, Mr. Host. Can you make me a co-host so that I could share some video with my students?
Hello, sir.
Yeah, honorable.
Sir, it seems you are already a co-host.
No, I have joined with my other device on which I have the videos. So if I'm not assigned co-host, it will be a bit challenging for me to share that with you. But let's see how it works out. Please, the name is KWARTENG. So if you can find that as part of the participants, kindly assign a co-host to it so I can share the video with the students.
Please come again and read the name, because unless we inform the IT people to do that.
Yes, it's KWARTENG. So I'm not seeing it here actually. So kindly check it out. All right, so I'm sure the IT people they have heard me and they would take action. I wanted to share a few slides with you, but I don't know. Okay, so you let me do the lecture. Maybe along the line, I'm sure it will be resolved. If not, we'll find a way out. All right, so let's continue. So now we look at what? The organic biomolecules. Thank you very much, Mr. Host. God bless you. Okay, so a few things to note about the organic biomolecule. All right, so a few things. In fact, the organic biomolecules are also a set of biomolecules which contain carbon, hydrogen, and oxygen all together. They contain carbon, hydrogen, and what? Oxygen all together. But this is not the only atom they may contain. Are you okay? It usually depends on which class of organic biomolecule you are dealing with. Apart from these, they may also contain other atoms like nitrogen, example for proteins, or phosphorus, also for proteins, and nucleic acids, or maybe sulfur, also for proteins. Are you okay? So depending on which species you are dealing with or which class you are dealing with, that will tell of the added atoms that may be present in the entire molecular structure. But basically, all of them contain carbon, hydrogen, and oxygen. The ratio of carbon to hydrogen to oxygen always differ from one biomolecule, organic biomolecule, to another. In carbohydrates, the carbon content or the carbon to hydrogen ratio usually is about 1:2. Are you okay? But in the case of lipids, the carbon to hydrogen ratio is relatively high. Relatively high. Okay, so that's basically about that. So take note that they contain carbon, hydrogen, and what? Oxygen. But they may also contain other atoms, such as nitrogen, phosphorus, or sulfur. In fact, even some metals, where example, when you're dealing with metalloproteins, okay, metalloproteins can contain other metals apart from the nitrogen and the phosphorus or sulfur that may be present. Okay. Point number 2, organic biomolecules may also, or they are able to dissolve very well in organic solvents. Usually, in chemistry, we used to say this, that the law of solvation, are you okay? The law that governs how soluble one substance can be in another states that like always dissolves like. Like always dissolves like. So polar solutes will always dissolve in polar solvents. Organic solutes dissolves in organic solvents. Non-polar solutes will always dissolve in non-polar solvents. Many organic substances are non-polar, and so they tend to dissolve a bit more in non-polar solvents, such as benzene, hexane, diethyl ether, and probably hexanol, are you okay? Or octapropyl alcohol. So these are just common examples. And then again, a third one is that organic biomolecules react very slowly among themselves. Example, if I take glucose in one test tube and I take galactose in another test tube and I pour the two together into one test tube for them to all react, you will soon realize that no matter how long I leave these two or this combination, they will not react. So they will remain just together like that. But when you introduce an enzyme, then the reaction is made possible. So many times we say that most organic biomolecules react very slowly or interminably. However, their reactions can be accelerated by the use of what? Enzymes. And that's why physiologically, many of the biochemical reactions which occur in our cells require the mediation by enzymes. Enzymes are very crucial for many of the biochemical reactions which occur in our body. The last one is that the organic biomolecules exhibit stereoisomerism. They exhibit stereoisomerism. I'm going to show you what I mean by stereoisomerism. Actually, by definition, it is the ability of a particular compound to exist in multiple forms. Are you okay? The ability of a particular organic compound which conform to a particular general formula, but can be expressed in different structural forms. Those different structural forms are what we term as stereoisomers. So let's look at this. Now, can you see what I'm showing you here? Please, can you all see my cursor? Hello?
Yes, sir, we can see it.
Yes,
Okay.
yes,
All
sir.
right. Okay. Let's consider the carbohydrate isomers and then come back to the rest. Now, the first one is what? What is this?
Glucose.
And then the next one is what?
Galactose.
Yes.
And then the other one is what?
Fructose.
Fructose.
Okay. Now, let us try and develop the molecular formula for each. So what will be the molecular formula for glucose? The molecular formula is the formula that indicates the number of atomic species. What atoms are here? We have carbon, we have hydrogen, and we have what? Oxygen. If you look at the molecule, these are all the only atoms available. So we have carbon. How many carbons are here? 1, 2, 3, 4, 5, and what? 6. So we're going to have C6. What about the H? How many hydrogens are in one molecule of glucose? We have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So we have 12 hydrogens. So we have
Sir,
C6,
please, 11.
H12. Then how
Sir,
about the
please,
oxygen?
it's 11.
They are not 11.
It's 12.
12. Then let's look at the oxygen. How many oxygens do we have? We have number 1, number 2, number 3, 4, 5, and 6. So we have C6, H12, O6. These are you okay?
Yes, sir.
All right. Now I want you to look at galactose and fructose and tell me their molecular formula. Yes. Anybody done?
Possible answers.
Yes,
Sir,
galactose. Any? Yes.
C6H12O5.
Is it O5?
O6.
Okay. How about the fructose?
C6, H13, O6,
Are you sure it's 814?
H13.
Are you sure?
Yes.
H12.
6, H12.
Okay. So for the fructose, we also have what? C6, H12, O6, isn't it?
Yes, please.
Okay. So what do we say here? You can see that all these three species have the same molecular formula, isn't it? But look at their
Yes, sir.
structure, are they the same?
No, sir.
So even though their molecular formula is identical, their structural formulas are different. And that is what we term as stereoisomerism. So the distribution of the atoms in space makes them different from all others. Are you okay?
Sir, I have a question.
All right. So this phenomenon is what we call stereoisomerism. Are you okay? So same molecular formula, but giving different arrangements results in different molecules. So different arrangement gives us glucose. Another different arrangement gives us what? Galactose. And another different arrangement gives us what? Fructose. Are you okay? And physically and chemically, they are all different. Glucose is sweet, but fructose is most sweeter. Are you okay? And galactose is the least sweet, even though they all conform to the same molecular formula. They are usually termed as monosaccharides. Are you okay? But their combination can create different effects altogether. You okay? Okay. So this is basically about that. Okay. But this is not the only one. Okay. Let's look at this one. Can you see my cursor? What's the name for this molecule?
Glucose.
It's what? L-glucose. Can you see that? And this is what?
D-glucose.
Okay. Now, can you see the difference between them?
Yes, sir.
Please kindly share with us.
Chamo. Una, eu me ayuda.
Yes, please, I'm listening.
The structure is different.
Structure is what? Different. You can see they don't differ that much, isn't it?
Yes.
They almost
Please,
have,
I want to try.
yes, go ahead.
Okay. So please, if you look at the carbon with the first one, we can see that it has been arranged from the top, starting from 1 to 6. But on the fifth carbon, we have the OH located on the fifth carbon to the left. And then when we come to the D-glucose, on the same fifth carbon, we have the OH located on the right. That's the opposite direction.
All right. Thank you very much, Mr. Joshua. God bless you.
Thank you.
So that's very true. That's very, very true. So this arrangement is more or less like a flip-flop. Are you okay? So the OH in a way is flipped to the right in D, but is flipped to the left in what? L. Physiologically, our body will use this D-glucose and reject this one. Most of our physiological enzymes are unable to identify the L and work with it. So if you consume this as part of diet, it will not be nutritive. Are you okay? As compared to this one. So currently, what we are trying to do, are you okay, by way of dietetic control of weight and diabetes, is that you can formulate heavy diets for diabetic patients by using the L carbohydrates so that they don't have to just be fasting. They can be taking their normal carbohydrate diet, but because the carbohydrates are in the L configuration, they become nutritive, non-nutritive. The enzymes are unable to work on them, and so they just go through their gut and they come out and don't add on to their weight, nor does it affect the hyperglycemic condition. Because we realize that people struggle to fast. The discipline is good, all right, but in the case where people have challenges, this could be an alternative. Are you okay? All right. Now look at the other one too. Can you see this? The first one is called what? G-alanine. And then the second one is called what? L-alanine. There is an amino acid. Are you okay? So these are stereoisomeric forms of alanine, which is an amino acid. In the amino acid, or in G-alanine, the amino group is to the left, but in L, it's rather to the right. Physiologically, our body prefers to use the L amino acid and reject the D. So our enzymes will select for the L and not for the D. Okay, so this goes to buttress the earlier point I made that organic biomolecules exist as stereoisomers. And this is not just for fun. It is to ensure physiological utility or usefulness. Because if they adapt other forms, it may not be physiologically useful. Are you okay? Is any question?
So please, I have a question.
Yes, sir. Why?
Okay, sir. So the isomerism, is it that since we have the same formula but different, arrangement, doesn't mean that it only exists between, maybe for example, if it is monosaccharide, supposed to be maybe between two monosaccharide, or can it exist between, let's say, polysaccharides and maybe monosaccharides? Thank you.
All right, thank you. Yes, any other? So in essence, the isomeric forms is just to enhance their biological activity. Are you okay? So organic biomolecules within us adapt stereoisomeric forms to enhance their physiological utility or physiological usefulness, or to improve or to enhance their biological activity. Because they are not there just to add on, but they are there to also promote what? General health. What you are seeing is a table of some common examples of biomolecules and what they do. There are several of them, but this is just a few to let you know that organic biomolecules are highly useful, very useful. The first is called what?
Folic
So
acid.
say that again.
Folic acid.
Yes, cholic acid. The cholic acid, this is what occurs in bile. Are you okay? This occurs in bile and it helps in the digestion of what? Lipids in the small intestine. Another example is called what? Hyaluronic acid. Shall we all say it together?
Hyaluronic acid.
Hyaluronic acid.
Okay.
Hyaluronic acid.
Okay. This acid is actually a carbohydrate in terms of classification, but it's a very, very important biomolecule. In fact, currently, it's being used so much in the cosmetic industry to treat various skin conditions. Even in biomedicine or in medical practice, especially in the cosmetic surgery, it's also used in enhancing the skin in diverse ways. It is all because it is a component of our interstitial fluids. I know the interstitial fluid is well adapted for almost all our tissue. So it's well tolerated on the body. Are you okay? And barely produce any notable risk for usage. So this explains one of the reasons why it's so useful. Are you okay? And it's very important in providing stability for body fluids like the cerebrospinal fluid, the synovial fluid for the joints, and aqueous humor of the eye for visual activity, and etc. Are you okay? They are vital components of body. Um, um, uh, so if you look at the chart I produce here, it tells you of the various ways by which hyaluronic acid is being employed currently. Okay, it's even being explored for anti-cancer effect. Okay, but because it's a very important component of synovial fluid for lubricating joints, it helps in arthritis treatment. Okay, in osteoarthritis, it's very powerful in enhancing treatment. Then, if you look at the list, we also have what we call acetylcholine. Can we all say it together? Acetylcholine.
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 So by classification, this is a lipid, and I'm sure you know basic physiology tells us that it's important in what? Impulse transmission. It's a neurotransmitter, so it helps in impulse what? Transmission. Then you have what we call prostaglandins. We may look at this later. It's lipid in nature and it modulates what? Pain. Okay. So once you produce a lot of prostaglandins, you get to feel a lot of what? Pain. And then you also have others, okay. So here you have several of them. Then we have glutathione. This is actually a peptide or polypeptide, and it helps in maintaining the membranes of the red blood cell, okay, from untimely lysis. The reason is that as red blood cells move through the blood, okay, a lot of the reactive oxygen species, which we spoke about earlier, begin to attack the red blood cells. And if the membrane is not well protected, many of the red blood cells will die prematurely. And when they die prematurely, we understand that it will affect what? The stability of the blood. Okay, because they are an essential component of the blood, and they are important for gaseous transport, oxygen, carbon dioxide. So if their levels fall, then they increase the risk of what? Infarction, shock, and etc. Are you okay? Let me hold it here and see if anybody has a question. Okay. So let's see.
Sir, please, I have a question. Hello, sir.
Yes, Honorable.
Now, sir, please, my network logged me out, so I didn't meet the first 2 points about the organic biomolecules. I just said the third and the fourth one. Please,
Number one,
could you repeat it for
okay.
me?
I said that they contain carbon, hydrogen, and what? Oxygen. But aside these three, which are core, they may also contain other other what elements like nitrogen, like sulfur, or what? Phosphorus. Are you okay? Number two, I said that they dissolve very well in what? Organic solvents. Are you okay?
Yes, sir.
All right. So now let's start off with carbohydrates. I'm going to start this with a video. And then when we are done with the video, we come back and then we'll talk about it. Okay. So kindly listen to the video very well, and then we'll discuss it together and we'll close. Okay.
Mute.
Please just give me a little time. I think my thing is frozen. So, all right. So let's deal with the slide I have here. Probably by the time we are done, we'll have the opportunity to watch the video. So carbohydrates serve as the most abundant organic biomolecule in our bodies. Okay, remember the most important organic biomolecule is what? Oxygen. Are you okay? And then the most abundant organic biomolecule is water. Sorry, the most abundant biomolecule is water. And the most abundant organic biomolecule is what? Is a carbohydrate. Carbohydrates conform to the general molecular formula CH2O into bracket N, where N can take numbers from what? 3, 4, 5, 6, 7. So what it means that N should always be greater than or equal to what? 3. So you should never have a carbohydrate whose atomic number is relatively lower than what? 3. And then they possess a large number of what? Hydroxyl group. If you remember the example I showed you earlier about the glucose, the galactose, and then the fructose, you would see that they had so much what? OH groups. Are you okay? Glucose has about 6 or 5 OH groups. Fructose equally has 5 OH groups. Just one molecule of fructose. In the same way, a molecule of galactose equally has what? 5 OH groups. Look at them. The OH, 1, 2, 3, 4, 5. That's for glucose. 1, 2, 3, 4, 5. For galactose, 1, 2, 3, 4, 5. For fructose. Okay. Okay. The last point is that physiologically, carbohydrates are stored as what? Glycogen in our body. Are you okay? For us as humans, even though they can be stored as cellulose in plants and as chitin in insects, in crustaceans, and in fungus. Are you okay? Many of the exoskeleton of crabs, of shrimps, and other organisms are not bones, but rather complex carbohydrates in the form of chitin. So what do they do? The physiological importance of what? Of carbohydrates. Carbohydrates do a lot of things in our body, and that's why we need them. Number one, they are what? They serve as raw materials for the synthesis of other biomolecules. They serve as what? Raw materials for the synthesis of other biomolecules. So let me just share this with you. Okay. Now, if you look at this is glucose, a simple sugar, but it can be used in diverse ways for various physiological processes. The same glucose can be used to produce what? Ribose. And you know ribose? It is used in the synthesis of nucleic acid. Are you okay? For cellular reproduction. Glucose can also be broken down to produce what? Pyruvate during cellular respiration for energy for the cell. It can also be packed together to form what you call glycogen. Okay. And then some amino acids break down and can be used to synthesize what? Glucose. So you could see that these simple forms of carbohydrates serve as raw materials for the synthesis of other important carbohydrates. Are you okay? I gave the example of what? Glycogen. Glycogen is stored in two major parts of our body. Number one, the liver, and number two, skeletal muscles. So the liver has a lot of glycogen. That is, if you have excess simple sugar to be stored, and then the skeletal muscles. Now, the two store glycogen for two different purposes. They don't store it for the same purpose. Glycogen in the liver is stored to ensure homeostatic glucose balance in our blood. So we often say that it is glycogen is stored in the liver for maintenance of normal glycemia. For maintenance of normal glycemia. But glycogen is stored in the muscle for energy during All right. Please kindly forgive me. I had to step out to take care of an emergency. All right. So I was saying that glycogen in the liver and glycogen in the muscles are not for the same physiological reasons or purposes. Are you okay? In the skeletal muscle, glycogen is stored for what? For energy. Are you okay? For immediate energy during fasting. So that's why sometimes you can go through a fast or you can go through a whole day unintentionally. Are you okay? You can go through a whole day without eating, and yet you'll still be very strong enough to be able to do everything you do. Sometimes you even forget yourself. Not that you are fasting, but just because of the demand of work or other things. You can go through the whole day without feeling hungry or anything. Are you okay? Why? Because the excess glycogen that has been reserved in your muscle can keep you going. Okay, so they are broken down for immediate energy for various muscular activity. But if glycogen is stored in the liver, it is rather intended to ensure that your blood glucose level doesn't fall. So you don't slide into hypoglycemia when you haven't eaten. Okay, so intermittently, the glycogen is broken down to release glucose into your blood. So you see that when you go through the whole day without eating, your blood glucose level doesn't really fall. It's steady. Are you okay? And that's a homeostatic attempt to ensure balance as you journey through the day. So that's basically how glycogen is reserved for needful days or moments like that. Are you okay? Please don't forget, glycogen is mainly stored where? In the liver and in the skeletal muscles. Are you okay? I think it's almost time, but let me ask if anybody has a question before I wrap up. So physiologically, number one, carbohydrates serve as what? Raw materials for energy generation or for the synthesis. They serve as raw material for the synthesis of other biomolecules. Are you okay? So glucose can be used for synthesizing what? Glycogen and stored for needful moments. Glucose can also be broken down through what we call pentose phosphate pathway to generate ribose, which is important in DNA and RNA synthesis. The glucose, again, can be broken down to produce what? Pyruvate, are you okay? Or lactate. Lactate accumulation causes muscle fatigue. Lactate accumulation. Lactate accumulation, are you okay, causes muscle fatigue. Secondly, simple forms of carbohydrates serve as energy source. So they are used as fuel to drive energy generation. Example, glucose is broken down in our cells to generate a lot of energy in the form of ATP to drive various physiological processes. Again, complex carbohydrates are stored as what? Energy reserve. So I gave you the example of glycogen. Glycogen is stored as energy reserve for needful times. Are you okay? Again, the levels of simple sugar in our body fluids can be used as a clinical biomarker for diagnosis of disease. So in diagnosing Down syndrome, are you okay? Oh, sorry, in diagnosing Cushing's syndrome and diabetes, we tend to measure glucose levels in CSF and then also in the blood. Are you okay? Amongst other indices. So this is very, very important. Are you okay? Some oligosaccharides, are you okay, are used as blood group determinants on our red blood cell surface. So some oligosaccharide chains occur on the surface of our red blood cells, and they give indication of our blood group, whether you are blood group A, O, AB, or what? B. Are you okay? Okay. All right, so this is basically what carbohydrates are stored for or are used for physiologically. The last one is that some simple forms of carbohydrates are also stored in semen, are you okay, as nourishment for sperm. Example, D-fructose. So you see that seminal fluid contains high amount of fructose, are you okay, and it is intended to serve as ready fuel for sperm. You know, the sperm cell has to really move, and it needs immediate source of what? Energy. Are you okay? And so the D-fructose serve for that purpose. Are you okay? And etc. All right. So this is the physiological use, a summary of the physiological use of glucose or of various physiological carbohydrates. The last one is that some of the physiological carbohydrates also serve as structural components of our body parts. So from our cell membrane to some other body organs on tissue, complex carbohydrates are involved in building their structure and in providing stability. Are you okay? All right. So that's basically about that. Common disease associated with carbohydrate metabolism in our body include, number one, type 2 diabetes, or let's say diabetes. You also have Cushing's syndrome. You also have lactose intolerance. You can also talk about galactosemia and such like. I think time is already up, so I wouldn't really want to bore you excessively. Before I sign off, let me see if anybody has a question for me. And then it's unfortunate we couldn't watch the video today, but hopefully next week, I hope we'll be able to make time to go through it. Yes. Any question, please? Hello, class.
Hello, sir.
Yes, any question?
No, please.
All right. All right. So thank you so much for coming. I wish you all the best of the weekend.
Thank you,
Now,
sir.
may God
Thank
bless
you,
you
sir.
and may He give you peace and may He prosper you.
Amen.
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 Amen. Thank you, sir.
Bye-bye.
God bless you.
Bye.
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 Bye, sir.